Monsoons, the time for hot chai, samosas and of course big relief from the harsh summers. But the season also brings with it a set of infections, especially in young children. With previously unheard type of flus spreading, monsoon is the time to be extra careful with respect to health. So how can we protect children from common monsoon infections? Let us learn from this report.
While all of us enjoy the pleasant weather of the monsoons, we are not the only ones. Microbes like bacteria, virus and fungi, along with parasites like mosquitoes and flies, thrive easily in this season, and the high humidity lowers immunity. Under these circumstances, the chances of contracting infections, especially among young children, are very high.
Gastrointestinal is starting from mouth, leading into vomiting. Then the infection can go down, that results into loose motion, loss of electrolytes, and then child going into dehydration. That is the thing. And in the monsoons also, the breeding for the bacteria through food contamination, it goes into the mouth, and that can cause severe diseases like typhoid, hepatitis A, and hepatitis B. The ideal thing is they should be learning how to wash their hands, avoid eating outside, and if they want to eat outside, at least that should be the boiled one.
Respiratory tract infections like common cold, cough, asthma and sinus infections, disorders of the digestive system like indigestion, diarrhea, cholera and typhoid fever are very common among children during the monsoons. Skin and eye infections due to dirty water and wet clothes are also a common problem. Prevention indeed is better than cure, and a few simple practices can keep these infections at bay and protect our children. Vaccinate children against cholera, typhoid and jaundice. Use clean, purified and boiled water for drinking. Avoid giving children water and food from outside. Also keep the food covered and avoid uncovered, stale and cold food. Make sure children wash their hands and feet thoroughly with clean water and soap after being exposed to stagnant or unclean rainwater and dry them properly. Keep your surroundings neat and clean and avoid stagnation of water. Let children wear open wear like flip-flops or strapped sandals and avoid shoes and socks. Similarly, make them wear clean and dry clothes and avoid dampness. Using air conditioner is not advised in monsoons. Do not sleep with windows open and use mosquito nets and insect repellents. Last but not the least, it's self-medication and get expert medical counsel in case of symptoms. Let us ensure that our children enjoy healthy and delightful monsoons.